Ventricular tachycardia, or V-Tach. There are two different types, mono and polymorphic V-Tach. Mono meaning same, morph meaning shape. So the QRSs are going to be the same size and shape and share the same amplitude or height. So we're going to go over monomorphic V-Tach first. Pathophysiology, there are two different types, ectopy versus reentry. So if you have some irritable ectopic focus in the ventricles, it's generally due to lack of oxygen. Whereas when you have reentry, it's generally going to be cardiac in origin. This could be an underlying MI or a recent cardiac surgery. Recall what a PVC is, a premature ventricular contraction. And this premature ventricular beat happens earlier than expected in the cardiac cycle. There's no P wave, and the QRS is going to look wide and bizarre. This is generally due to irritability. Now, if you have 3 or more of these PVCs, we call this a short run of V-Tach. Now, V-Tach is in two different categories, sustained versus non-sustained. Sustained means that the V-Tach has ran longer than 30 seconds. Now, this is transient, it can come and go, and when it does, you want to measure how long they were in V-Tach and how many times. Now, believe it or not, your patient could be hemodynamically stable and be in monomorphic V-Tach. Now, in terms of the rate, 120 to 250 times per minute. Generally speaking, if it's less than 120, they call this slow V-Tach. P waves, they are present, but generally speaking, you're not going to see them. And if you do see them, you're going to see less P waves than QRSs. This is another type of AV dissociation where you actually have two different heart rates. PR interval, undefined, the QRS is going to be wide, and generally speaking, if you can measure it, it's going to be greater than 0.14 seconds. The rhythm is going to be regular. Now, this particular rhythm is in two different algorithms in ACLS. It's in the tachycardia algorithm, and it's also in cardiac arrest algorithm. The difference between the two, does the patient have a blood pressure or not? So if on your ACLS exam, you see something like patient has a pulse that's not detectable, or the blood pressure is 0, we now call this pulseless V-Tach. Now there is one rhythm that gets confused with monomorphic V-Tach, and that is SVT with aberrancy. So if you have a supraventricular tachycardia with aberrancy, we treat it as a wide complex tachycardia. So in other words, what this means is if you have a wide complex tachycardia and you can't tell the difference between SVT with aberrancy versus monomorphic V-Tach, treat it as monomorphic V-Tach until proven otherwise.